Hello and welcome to the Headache Doctor podcast, where on this podcast, it's our mission to educate and empower everyone with headaches and migraines so that you can break free from a life of fear of your next headache or migraine and dependence on medication. In today's podcast, we have Dr. Sarah Thomas visiting with us again. Thanks so much for being on the Headache Doctor podcast.
Yeah, I'm excited to be back. It's been a bit, so excited to talk about a new topic today.
Since you were last on the podcast, you've had a baby, which is amazing, and now are back helping people with headaches and migraines in our Parker office. Welcome back.
Thank you. Yeah, I was gonna say all exciting things. He's doing super well. He's 5 months old now, so time flies, and it's all gone really well. It was a little bit of a crazy summer, so I appreciated the leave that Colorado provides. But excited to be back. Still just part time, but it's fun to kind of have all the aspects of life with motherhood and headache management. So.
Okay, so for today's podcast, we are going to talk about the latest and greatest weight loss drugs. We wanted to talk about, these GLP-1 agonists, we wanted to talk about them, one, because we have several patients that are on them, and there's interactions with, just our health in general that we as providers here at Novera Headache Center care about the overall health of the patient. And so when it comes to navigating something like weight loss and using medication for that, especially when it's new and growing rapidly in popularity, we wanted to make sure that we talked about the interactions with those of you that are suffering with headaches and migraines, things that you should be aware of, things like side effects, benefits, so that you can evaluate something like these GLP-1 agonists appropriately. And so Dr. Thomas did a bunch of research. And so essentially I'm going to be interviewing her and we're going to be diving into this topic. So without further ado, let's maybe just work with some definitions to start on what are we even talking about and what are the mechanisms here?
Yeah. So just to say a little bit, kind of a little of introduction too. This actually comes from a patient question. So obviously we work with patients every day. They see stuff on the news, they see stuff on Facebook, Instagram, all over the place. And they will come to us with questions on, what about this? So this actually is a specific patient question. It happened right before I went on maternity leave that someone said, I think they had seen on either Instagram or Reddit, that GLP-1 agonists specifically were really good for pain and headaches. And they asked me about my opinions on that. And I was like, I have absolutely no idea. So I did do a bunch of research and then I did go on maternity leave. So that's the delay, but you know who you are. You inspired this podcast if you're listening. So that's why we're talking a little bit about that today too, is just the research on that. So yes, definitions on the GLP. So usually they'll be referred to, I feel like just in the media, it'll just say, GLP drugs, GLP-1. What they specifically are, like Dr. Taves says, is GLP-1 agonists, and we'll go into what that means in a minute. But these are a really common drug for weight loss. They are becoming more and more common. I think about 1 in 8 Americans are on them at this time. So huge number. Pretty much if you know 10 people in America, you know someone that is using these drugs. They are very new on the market. The first one was only approved in 2005. So we're looking at about 20 years, which for a drug is very, very short-lived. So this is a very new procedure. They also are usually under the brand name of like Wegovy, Trulicity, Ozempic. Those are the big ones. There's a lot on the market, but these are something that you've probably seen. Again, if you don't know what I say when I say GLP, think of Ozempic is probably the one you're thinking of. So what they do is they essentially mimic a natural hormone we have in our body called GLP-1. And so GLP-1, when it's released, it acts just kind of like an appetite suppressant. So it helps stimulate the production of insulin. Insulin, we know, if you know anything about diabetes, we know that insulin is what stimulates the cells to take sugar up. So GLP-1 basically tells the body to have the cells take sugar into them, which can lower your blood sugar. It also helps block the production or the use of glucagon, which helps, again, lower the blood sugar. It helps reduce the feeling of, promote the feeling of fullness or reduce the feeling of hunger. And it does slow stomach emptying. So that's what that hormone does. And then GLP-1 drugs, they help mimic that. So that's what agonist means, is essentially an agonist is just any sort of a drug that acts like something. An antagonist is something obviously that acts against something. So by having this GLP-1 agonist, essentially you've got this drug that acts the same way as GLP-1 does in the body.
Yeah, that's great. And just as a frame of reference for the listeners, medication in general is usually working in this way, agonist, antagonist. So we're promoting something, we're creating something that binds to a receptor and then signals in a similar way as something that naturally happens in the body, but we're creating a synthetic version of it. And so that's where like the side effects come from. The something that's foreign to the body but mimics something in the body is essentially what I would say most medications it boils down to is, okay, we know that this GLP-1 is what's causing these things that have benefit to the body. And I think one of the things that I hear frequently is the urge or desire or the cravings that people have, they tend to go away, that feeling of satiety or fullness. And so we're sort of short-circuiting that, triggering that in the body using these GLP-1 agonists because it mimics that. Yeah.
Exactly. And so these, obviously, it comes as no surprise that most of the conditions these are used for are related to hunger and weight. So typically what these will be used for is weight management, type 2 diabetes, and cardiovascular disease. Ozempic has kind of the distinction of also being approved for chronic kidney disease. But these will typically be used if a patient is struggling to lose weight, if they just, for health reasons, really desperately need to lose weight. This is typically what they'll be used for, and they are injected. The kind of fun thing about these is where they're so new, the regulation is a little bit all over the place. So the FDA has approved some of them for some specific conditions, but as a whole, the GLP-1 drugs have not been all like overall approved for something. So when you use a GLP-1 agonist, depending on the drug, it may or may not have gone through really rigorous testing. It may not be regulated. A lot of prescribers will use these in what's called off-label use. So your drug may not officially be approved for anything, or say maybe it's approved for type 2 diabetes, but it's not approved for weight management or cardiovascular. Your physician may still approve that. And like I said, they'll do it off-label, which means that you open yourself up for a really interesting question of what this drug is doing, how it's made, which we'll talk about in a second. But a lot of these are not heavily regulated or studied at this time.
Yeah, I don't know this off the top of my head, but there's probably lots of medications that are used for off-label purposes. So that's a very common practice within our healthcare system. How they're made, I'm interested to hear that.
Yeah, so this is actually kind of a really interesting tangent here. So again, I did this research back in May. So there is a little bit of an update to it, but essentially what happened is these drugs were initially, I think, quite expensive and not really covered by insurance. But there was a shortage of them back a few years ago. So what the FDA allowed pharmacies to do is they allowed pharmacies to create what's called compounded versions. And this is just a version created by the pharmacy themselves. They create this and then they can sell it just kind of, I hate to say under the table is probably a little bit too strong, but essentially you can sort of sell it with a lot less regulation. So what happened for a lot of years is places like telehealth companies and health spas suddenly had access to pretty cheap and pretty widely available compounded drugs, just because, again, when there was a shortage, the FDA allows this to happen. Now, about, I believe, the start of this year, that shortage, I don't know exactly what happened, but that shortage suddenly wasn't a shortage anymore, and so these drugs were more widely available through normal channels. The FDA then retracted that ability to get these compounded, which means that pharmacies can no longer sort of create their own version of sort of, again, not quite under the table, but sort of a little bit less regulated. They lost the privilege to do that at the start of the year. And so what they did is they suddenly left people sort of essentially hanging, where people had been able to get very cheap versions of these drugs up until recently. And then suddenly the versions that are available are either very expensive or not covered by insurance or something. So it actually left people in quite a bit of a bind. I was able to look today, and it does look like there's some progress being made in this area. But essentially, I think Costco now is offering a fairly cheap version of it. It does look like very, very recently in the last day or two, there's some government deals, if you're in the United States, that are going on to make these a lot more affordable. But it was an interesting sort of history where it became, like I said, it became very widely available and then suddenly wasn't very available. And so they do tend to be very expensive right now.
Yeah. Okay. So when it comes to these drugs, it feels like when you watch advertisements or just a sense of like communicating with those that are taking it, feels like, we've created this Disneyland drug where there's, no side effects, you lose weight. But what is, if we peel back the layers, kind of what's the reality here? Like, what are some of the side effects that people are seeing? What's the process people have to go through? Like, let's go into that a little bit.
Yeah. So side effects, I'm actually going to read. I've got a long list. So ready for side effects here. So obvious ones are GI symptoms like nausea, vomiting, loss of appetite is, I'm not sure that technically counts as a side effect because to me that's what you're taking it for, but that is a side effect, is loss of appetite. You can get dizziness, infections, headache. Fun fact is actually can be a little bit more of a rare side effect. Can get mild tachycardia. Obviously, any drug you can be allergic to, so an allergic reaction can be a possible issue. Hypoglycemia, fun fact too. Obviously, you're playing with a drug that regulates your blood sugar, so it can go too far the other direction where your blood sugar actually drops too low, which can cause some problems. Kidney problems, also an issue. They are also not safe during pregnancy. I believe they have some animal studies that indicate that they can cause some negative changes to the baby. So definitely a lot of side effects going on. And yeah, the process for getting them, I looked at both Wegovy and Ozempic are two of the really big ones. And it looks like they will work with you to try and figure out. I do still believe you need at least a doctor to say in some capacity or another that you need them. I could be wrong on that. I don't know. Part of the problem by making these so expensive is there's kind of a really interesting counterfeit and sort of online industry that's popped up that can be very dangerous. So my guess is you can acquire them through probably good channels and sort of iffy channels as well. But that is part of the problem by making them so expensive, is they have made them very hard to get.
Okay, as far as the when a physician is prescribing the medication, or if it's just sort of like general recommendation, I think I've seen on their ads like, we recommend lifestyle change, blah blah blah. Mm-hmm. So what's the general sense of like, are people needing to change their lifestyle as well, or is this just like you are on this medication and you start losing weight?
Yeah, 100%. So what they recommend is that these drugs are used in conjunction. So just because you are taking this drug does not mean you can continue to eat whatever you want, not exercise. The recommendation is definitely that this is used in conjunction with lifestyle changes. Essentially, I believe this drug initially was developed for people that were already trying, we're trying the lifestyle, we're trying to reduce reduce diet, eat a healthier diet, and then increase exercise. And sometimes it still can be difficult even with those. There's a lot of things that go into weight loss as far as hormones and environment and everything. So these drugs were kind of essentially a helper when you were trying to lose weight. They are not designed to be you just inject this and go about whatever you're doing. They're definitely designed. And as far as timing, I don't know how long they're generally recommended to use for, but I would hope it's not lifelong. That feels like that's pretty extreme.
Yeah. One of the things I've noticed is, and I think this is when we look at our healthcare system, and when a provider is prescribing a medication, my experience as a physical therapist who doesn't prescribe but is talking to patients through some of the risks of their medications, or really the mechanism of their medication, or if the medication should be used long term. Rarely, if ever, do I find someone who understands the impact it's having on their body and any sort of plan to not take the medication. And so I want to talk a little bit about the understanding of, okay, this drug is seemingly helping a lot of people lose weight, control their blood glucose levels, if they're diabetic, pre-diabetic. So there's a lot of good to it. But let's maybe zoom out and just talk about, okay, what is it actually doing here? And is there an alternative to it? But what should the long-term game be for your overall health?
Yeah. So I'll use an interesting example with this. So I think we probably all know someone that's gone through gastric bypass surgery. Is sort of it also a weight management. I don't know if I'd say it's like exactly like GLP-1 drugs, but another form of losing weight. And initially when you go through gastric bypass, you essentially shrink the size of the stomach. And for a bit, your appetite is very decreased because your stomach is tiny and you lose a fantastic amount of weight. But the problem is a lot of times your stomach will stretch back out. And so if you have not figured out, okay, this is a healthy diet, these are portion sizes, I also need to exercise, it's very easy and I think quite common, if I'm not mistaken, to just gain all that weight back. And I imagine the same with these appetite suppressant drugs that, okay, great, I'm, injecting this drug and it's telling my body to take sugar up from my bloodstream. It's telling my body not to be hungry. That's fantastic. But unless you continue to take that for the rest of your life, the instant you get off of that, or, I don't know if there's any sort of a time period where it takes your body to readjust, but your body is going to go back to being, okay, like we don't have anything telling us to take sugar up. We don't have anything telling us not to eat. And if you haven't looked at what a healthy lifestyle looks like, to me, it seems pretty obvious that you're just going to gain that weight right back. And so I think that's why these can be helpful, but these shouldn't be the only thing you rely on for a healthy diet and a healthy lifestyle.
Yeah, there's a little bit of irony in this because our culturally, when we look at the foods that we consume, the journey that they've been on, and whether it's food scientists, as we aggregate in large cities, there's a need for shelf-stable and cheaper foods. And generally that means they are increasing in calories. The chemical processes that go into creating our foods now are fairly extensive. And, it's like, what is a Twinkie? I don't know. What is an Oreo? Like, have you seen the YouTube video where they try to torch the Oreo and like after like 2 minutes of torching the thing, it like basically doesn't change. So anyways, there's like our food has become something other than food. And there's a significant increase in the amount of like seed oils and essentially the components of our food that make them shelf stable, easy to ship, and feed large quantities of people are high calorie, and then they are intentionally designed to reduce satiety. Okay, and so what we see is even people that are generally moving towards health and trying to eat healthier, it's really hard to have a diet that caters to like what your body actually needs. And so we see the rate of obesity increase in diabetes, and then we have a large population of people that need to lose weight. And then essentially we've created a drug that does the opposite of the foods that we engineered to essentially be higher calories, reduce satiety, so we can eat more. We have all this blood glucose running through our system. We have pre-diabetics, diabetics, obesity, and then we create a drug that solves the problem. Now, in theory, should I say in theory there? I don't know. But basically what we should pursue is health in general, whether it's like increase activity, caloric output, decrease caloric input, meaning like we want to eat natural whole foods. And then we also want to look at like sleep, stress level, stuff like that. We want to look at these pillars of health. And so when we enter into what does health look like, medication doesn't really have a category. And so when we're looking at something like this GLP-1 agonist, we want to understand it in a sense of like it's a catalyst for change, but ultimately the lifestyle changes, and educating yourself and understanding, okay, what does my body actually need, is what we should be pursuing. And I think one of my hesitancies is the long-term nature, that people are being told like, hey, this is like really, if you don't feel any side effects, just keep taking it. And I do think our healthcare system is very comfortable with long-term use of medications. And as opposed to, like I said, the catalyst for change. And then once you start seeing the change, let's wean off.
Yeah, I agree. I do want to say here that weight loss can be very difficult. There's a lot of emotion that goes into it. There's a lot that goes into that. So it is not a simple process sometimes. And I, as a healthcare provider, obviously I can't prescribe these, but as a healthcare provider, if you do need something, just like Dr. Taves was saying, just as a catalyst for, I need a little help losing the first 20 or 30 pounds or something. And then after that, as I'm doing that, I can be looking at my diet and I can be figuring out good healthy habits and I can start exercising. I think that's fine. But I'm with Dr. Taves that I don't believe these should ever be used. I don't really think this is the idea that they get used forever, but I think that's just what happens. Because again, it's really easy. No one likes shots, but just inject something every so often and then you don't have to make any changes. And that's much easier, but it's not really healthy in the long run.
Yeah, I guess I would like to poke at the system that we're all living in rather than individuals, because the system we're living in is not in our favor. And so very few, as we're seeing, are able to actually live healthy lifestyles in the United States. And so it's less of a conversation about like, oh, like you just need to try harder to lose weight. I mean, there's probably people that are in that category for sure. But in general, what I'm talking about is, I mean, you go to a grocery store and look at like their protein bar section, okay? And I can almost guarantee you like very few of those protein bars are actually healthy for you, but they are branded and advertised in a way where you would think without that protein bar, it's like, how are you living, right? Like we are advertised at so hard in a way that we take foods, we break them down to their individual components, and we put them back in shelf-stable bars or processed foods, and then we give them back to you, right? Like Cheerios, good for your heart. Like no, like just eat a real whole food. You don't have to eat Cheerios to reduce your cholesterol level. Like our body was meant to eat whole foods that come like from the ground, and the further we get away from that, the harder it is for us to get out of this cycle of I'm trying to lose weight. I'm trying to like get my energy back. I have high levels of inflammation. Like I'm trying to deal with pain. It's actually really interesting. They like something like a carrot, and you can list all the micro, macronutrients, the vitamins, minerals, everything that's in a carrot. And then if you were to reduce those and take the individual components, put them in something like a bar, and then have someone eat a carrot and have someone eat the bar, the nutritional value is far less for the bar. And food scientists can't understand why that's the case. And so there's something about whole foods that is, it's complex enough. It can't be reduced down to its individual components. And so there's kind of a beauty to that in a sense. And so again, I'd like to poke at the system here because essentially if we're working in a system that's creating a problem, and then it's like, okay, we have a solution now, and that solution, I mean, is clearly there's a lot of dollars attached to this thing, then personally I say let's use it as a catalyst, but let's move towards the lifestyle changes to give our body what it needs, and then not look at this as a long-term thing.
Yeah, I agree. And I will say, so I think that covers the diet pretty well. The reason we brought this up today, though, is there's actually some really interesting benefits to headaches. Fun fact with the GLPs. And this was kind of where this podcast sort of came from, is again, that patient asked me if there was anything to these being good for pain. And the answer, funny enough, is actually yes. And I will say, to my knowledge, the GLP-1 drugs have never been approved for pain management, at least not yet. But there's actually some indications. So obesity is an inflammatory condition. It tends to have a lot of inflammation associated with it. And you can also we've talked about central sensitization quite a bit on this podcast. So by taking a GLP-1 drug and reducing this inflammation, reducing this weight, you actually can decrease your central sensitization. You can decrease your inflammation, which many of our patients know a lot of times your body has a certain amount of tension in your neck or other areas that is contributing to your headaches, but it can ignore it up to a certain point. And once there's really high degrees of inflammation, your body can't ignore that. And that's what tends to send you over the threshold for getting a headache. Taking these drugs can kind of conversely help reduce your inflammation, and then that can actually reduce your headache days. So there is some really interesting preliminary evidence that taking a GLP-1 drug can cut your migraines down. I believe actually a recent study over the summer came out and said they found that those headaches were reduced by about half, headache days, migraine days, I think specifically. So there is some really interesting, and I'll kind of let people take this with a grain of salt. As I said before, you are introducing a substance into your body. You're not addressing the root cause of the problem with the headache. But by reducing that inflammation, you can have some interesting pain benefits. And again, not approved, but something that I think will be interesting as time goes on to see where that research goes.
Yeah. And I think that's helpful to understand when it comes to how we perceive pain, the environment our brain is perceiving the pain in. It's inflammation plays a key role there. And so there are other medications, classifications of drugs that reduce inflammation levels. Inflammation is not only impacting the brain and how it's perceiving pain, but local inflammation is what's actually sending the pain signal. And wasn't there an interaction with blood vessels as well? Something there?
It can, even just specifically, it can reduce inflammation within the brain. So that can help, just again, kind of the same thing, but essentially reduce just the sensitive, kind of how sensitive the head is. So that can definitely also reduce pain.
Yeah, we have this. So when we think about head pain, the whole problem is that there's something triggering this pain pathway, and that pain pathway is not only sensitizing the brain and the face and the neck, and so there's these different parts of the head, face, neck that if one of them is impacted, it can trigger that whole cycle again. And so there's that. There's the threshold side of it. There's the overlapping of what we call referred pain. And so headaches and migraines get pretty complex. But that's where, like, if we would look at this as like, oh, migraines are an inflammation problem and this solves the inflammation problem, there's a deeper level to that. And that's what Dr. Thomas is referring to in the sense, like, we need to understand why you're getting a pain signal in the first place.
Yeah. And I think, again, it kind of goes along to be, even if they are useful for headache and migraine days, it's still just the same as any other drug where you're just masking the symptoms. And so kind of the bottom line from what my research indicated is there is kind of some promise with this. Obviously, if you are struggling to lose weight, this can be very helpful. There seems to be some indication it's good for pain as well. But the bottom line is you are introducing a substance into your body. We don't know what it's going to do. And like I said, it really, at this time, the research and the regulation is kind of all over the place. So especially if you really are desperate enough to turn to like some online, I saw somewhere that a lot of people are going to like Mexico to get their GLP drugs, and getting an injectable from Mexico seems like it's not advisable to me as a healthcare provider. So I think you need to go into any decision you make around this with kind of eyes wide open. You need to be aware that just because this looks really promising on the surface, there are some deeper layers to it.
Yeah, absolutely. Well, does that about wrap it up?
Yeah, that's about all I've got.
Cool. All right. So there you go. GLP-1 agonist, something maybe you thought you'd never hear on the Headache Doctor podcast, but because of its interaction with headaches and migraines, the question we got from a patient, and then just our pursuit of overall health, we thought it was appropriate to talk about. And I hope you all found it helpful. Thank you all so much for being a part of this journey of helping people break free from their next headache or migraine and dependence on medication. Stay tuned next week, and we'll see you then.